New Democrat proposed legislation at the state capitol could allow Wisconsinites to put themselves on a do not sell list, barring themselves from purchasing a firearm, all in the name of suicide prevention. Of course, the proposal would need bipartisan backing. Our Maddie Heimsch explains the bill and examines that support from both sides of the aisle.
This is a really modest thing that we can do that could potentially have a big difference.
State Senator Kelda Roys is the lead author of a bill that would allow individuals to prohibit themselves from buying a handgun.
When you go to a gun shop and say, I want to buy a firearm, they can look and say, you know what, you're on the do not sell list. Let me connect you with some resources to help you.
Roys says the bill that would work through a state Department of Justice database is a suicide prevention measure.
To make sure that someone who is experiencing depression or a mental health crisis or thoughts of self-harm is given help and resources and not a weapon that will let them end their life.
And if passed as written, the legislation would allow a person to put themselves on a 1, 5, or 20-year list. The 1-year list is irreversible, but after a year on the others, the individual could be removed by request, subject to a 48-hour waiting period.
Just to make sure that you're not in the midst of a mental health crisis or having thoughts of self-harm when you request that gun.
Roy says she can see the bill getting bipartisan support.
Thoughts of self-harm don't discriminate based on your politics.
While we wouldn't author it, I don't know that we would oppose it either.
Wisconsin Firearm Owners President Rob Kovac says he sees that possibility too, but would want some extra assurance.
We would want to make sure that it truly is voluntary and that people who want to maintain their ability to own firearms are still protected.
According to the Bloomberg School of Public Health, guns are the most lethal suicide method, making up more than half of suicide deaths in 2023, despite only being used in a fraction of total attempts. Still, Kovac says more can be done to tackle suicide prevention without fixating on the guns.
But firearms are only a small part of suicide prevention, so the legislature should continue working on ways to better give access for folks to mental health care.
Reporting in Madison, I'm Maddie Heimsch, News 3 Now.